May is Brain Tumor Awareness Month, and there are nearly 700,000 people affected in the United States alone. Dr. Wendy Sherman from Spectrum Health is here to tell us more. Good morning, doctor.
Good morning.
Now, when people hear the word tumor, they might automatically think cancer, but not all tumors are cancerous, and this includes brain tumors too, correct?
That's right. So there are, like you said, numerous types of brain tumors, but some are cancerous and some are non-cancerous.
And how does a brain tumor even begin to grow? Walk me through the process of how does a tumor start?
You know, different types of brain tumors grow at different rates and in different locations. So the symptoms that someone might have all depends on how fast they grow and where they grow.
Okay. So the location of where the tumor is in the brain can give completely different symptoms if it's located in the back, the front, the left, the right?
Exactly.
Okay, could you give me a couple of examples of what symptoms might be in one area versus another?
Yeah, so for example, if a tumor were to grow in the front part of the brain, on either side it could cause personality changes. If a tumor were to grow on your right side, where it controls the motor on the left side, then you might become weak on the left side. The right side of the brain controls the left side of the body. Okay, so those symptoms, you've touched on some of them, and there are other symptoms. There's a long list, really. They could be fairly difficult to diagnose. They can be. You know, symptoms can include if your normal pattern of headaches start to change, you develop a different type of headache or a new onset of a headache. If headaches become very frequent and severe, if you develop weakness and numbness on one side of the body, or language problems, speech problems, or seizures, none of these indicate that you for sure have a brain tumor, but they could be symptoms of one.
Yeah, we don't want people thinking, I have a headache, I have a brain tumor.
That's exactly right.
Obviously. And it's just disturbing to even think there is a pattern of headaches for some people, but it is true.
Yeah.
So when this happens, the diagnosis, I'm assuming, involves an MRI. Are there ways to determine whether someone has a brain tumor?
Yeah, that's right. Usually we first start with a complete neurologic exam, either by your primary care physician or a neurologist, and they'll test your vision, your strength, your sensation, your coordination. And then usually from there, after they try to localize maybe where the problem might be in the brain from that exam, then you would go on to get an MRI. There's other types of tests that are sometimes used, but usually the MRI is the next step.
Yeah, the MRI will show the picture and the size and location of the tumor if there is one, correct?
That's exactly right.
Okay,
yeah.
And then treating a brain tumor, it's got to be a bit trickier than maybe other locations in your body.
It is, it is. And really the treatment all depends on what it looks like on the MRI and what we think it is. So some tumors we watch and you don't necessarily need to do anything about them, but other ones you do need to intervene. Usually the first step involves surgery, and so our team offers awake craniotomy, which allows the patient to stay awake. You don't feel the surgery, but it essentially allows us to make sure that you don't walk out of the operating room with speech problems or weakness on one side, because you stay awake and we're able to test you during it.
So while you actually have the patient's, part of their patient's skull removed, and you're doing the work on the brain with it exposed, you're talking to the patient?
Correct. Yeah.
I've seen that scene in a movie once, and but it was just it wasn't the same type of thing.
No.
You know what movie I'm talking about?
I do.
Okay.
I do.
Wow. I didn't know. So they're actually conscious and awake while this is going on.
Right. So we offer that, and then we also offer intraoperative MRI, which the patient is asleep during the surgery. But they use MRI during the surgery for more complex tumors so that we can really get out as much as we can safely without causing damage to the surrounding brain.
Now, I noticed you mentioned the word team, and that really is what you have here. This is not just one doctor. You've got a slew, like a brain team, like a brain and spine team, really. But I mean, there's more than one person taking care of the patient at Spectrum.
That's exactly right. So our team includes a neurosurgeon, a neuro-oncologist, we have psychiatry, neuropsychology, social worker, physical therapy, and then we have a nurse navigator, which is really a vital part to our team.
And I wanted to ask you more about what that nurse navigator, I saw those words and I wondered, what exactly does a nurse navigator do? Is that like almost like a concierge and to navigate you through the whole process?
That's exactly right.
Okay.
So she's really the advocate for the patient and the family. She helps coordinate appointments. She'll come in because when you meet with our team, the patient and the family stay in one room, and the providers will rotate through the room. And then at the end, the nurse navigator will come and sort of summarize everything, make sure that they understand everything that happened during that morning, and coordinate any other tests or appointments that need to come after.
Well, once someone's been diagnosed with a brain tumor, I'm sure the stress of what they're going through is alone enough to have them scatterbrained, for lack of a better term. So having that nurse navigator there to walk them through all the steps has got to be a good comfort to your patients.
Absolutely. It can be very overwhelming. There's lots of different treatments that we can use. There's clinical trials, investigational agents, and so those are very complex discussions. So it helps to have someone come in at the end and make sure that they understand everything.
Excellent. Thank you so much for the time, Doctor.
Yeah, you're
Appreciate
welcome.
it. I'm glad that it's all right here in Grand Rapids as well. Dr. Wendy Sherman is a specialist in neuro-oncology, and she's located at 25 Michigan Street Northeast in Suite 6100 in Grand Rapids. If you'd like to schedule an appointment with her, you can do that at 616-267-7900. Or if you have been diagnosed with cancer and would like a second opinion or consultation, please call 1-855-SH-CANCER. That's 855-742-2623.